We often talk about the heart as the seat of our emotions. It's a common metaphor that transcends cultures and languages, symbolizing the core of our emotional experiences. We feel joy in our hearts, a sensation that can make us feel light and uplifted, as if our hearts are soaring. We carry the weight of sadness, a heavy burden that can make our hearts feel like they are sinking, and we experience the flutter of love, a feeling that can make our hearts race with excitement and anticipation. What we sometimes forget is that the heart is not just a metaphorical vessel for our feelings, it's a vital organ profoundly affected by our emotional well-being. The connection between our emotions and our heart is more than just symbolic. While we easily understand the impact of physical stress on our bodies, emotional stress often flies under the radar. Its effects subtle yet significant. Emotional stress can creep up on us, manifesting in ways we might not immediately recognize. But what happens when intense emotional stress manifests physically, impacting the very organ seemingly at the center of it all? The heart, which we often associate with our deepest feelings, can actually suffer from the weight of those emotions. The answer lies in a condition that sounds almost too poetic to be true broken heart syndrome. This condition is a stark reminder of how closely our emotional and physical health are intertwined. This condition, known medically as Takotsubo cardiomyopathy, demonstrates the profound connection between our minds and bodies. It shows that our hearts can be physically affected by the emotional turmoil we experience. Highlighting the very real and potentially dangerous impact of emotional stress on our physical health, Takotsubo cardiomyopathy serves as a powerful example of how our emotions can take a physical toll on our bodies. It's a reminder to take care of our emotional well-being just as we do our physical health. Broken heart syndrome, also known as stress-induced cardiomyopathy or Takotsubo cardiomyopathy, is a temporary heart condition brought on by intense emotional or physical stress. This condition is often mistaken for a heart attack because the symptoms and test results are similar. It's often triggered by events like the death of a loved one, a breakup or divorce, financial troubles, or other significant stresses. These events can cause a sudden surge of stress hormones that temporarily affect the heart's ability to pump blood effectively. Interestingly, even positive events like a surprise party, winning a lottery, or a sudden unexpected joy can trigger this syndrome. The heart's reaction to these intense emotions can be quite dramatic. The condition primarily affects the heart's main pumping chamber, the left ventricle, causing it to temporarily enlarge and weaken. This enlargement disrupts the heart's normal pumping function, leading to symptoms that mimic those of a heart attack, such as chest pain and shortness of breath. This weakening disrupts the heart's normal pumping function, leading to symptoms that mimic a heart attack. Patients often experience sudden chest pain, shortness of breath, and may even collapse, prompting emergency medical attention. While the exact mechanisms are still being studied, scientists believe a surge of stress hormones like adrenaline plays a significant role. These hormones can have a temporary but profound effect on the heart muscle, leading to the characteristic changes seen in broken heart syndrome. These hormones, released during times of stress, can temporarily stun the heart, leading to the characteristic changes in shape and function seen in broken heart syndrome. Recovery is usually quick, with most patients regaining normal heart function within a few weeks, but the experience can be quite frightening and is a reminder of the powerful connection between our emotions and physical health. While anyone can experience broken heart syndrome, it predominantly affects women, particularly those who are post-menopausal. The reasons for this gender disparity aren't fully understood, but researchers believe hormonal differences, particularly the decline in estrogen after menopause, may play a role. Estrogen is thought to have protective effects on the heart, and its decrease after menopause might make women more susceptible to the effects of stress hormones. This doesn't mean men are immune. They can and do experience broken heart syndrome, but it's far less common. Understanding these risk factors is crucial in raising awareness and encouraging early diagnosis and treatment. The symptoms of broken heart syndrome often mirror those of a heart attack, making it challenging to differentiate between the two without proper medical evaluation. The most common symptom is chest pain, often described as a sudden intense pressure or squeezing sensation. Shortness of breath, irregular heartbeat, dizziness, and fainting are also common. Because of this symptom overlap, it's crucial to seek immediate medical attention if you experience any of these symptoms, especially following a stressful event. Prompt diagnosis and treatment are essential in managing the condition and preventing potential complications. Section 5. Diagnosis and treatment. Navigating the path to recovery. This section will guide you through the essential steps and procedures involved in diagnosing and treating broken heart syndrome, a condition that can be as emotionally challenging as it is physically demanding. Diagnosing broken heart syndrome involves a combination of tests and assessments. These tests are crucial for accurately identifying the condition and ruling out other potential heart issues that might present similar symptoms. Doctors typically begin with a physical exam and review of the patient's medical history, paying close attention to recent stressful events. Understanding the patient's emotional and psychological state is as important as the physical examination. An electrocardiogram, or EKG, is used to measure the heart's electrical activity. This test helps in detecting any irregularities in the heart's rhythm and electrical impulses, which are often indicative of broken heart syndrome. Blood tests can detect elevated levels of certain proteins released by the heart when it's damaged. These biomarkers are essential for confirming the diagnosis and assessing the extent of heart damage. Echocardiography, which uses sound waves to create images of the heart, remains the gold standard for diagnosing broken heart syndrome. This non-invasive test provides detailed images of the heart's structure and function. This imaging test can reveal the characteristic ballooning of the left ventricle, a hallmark sign of broken heart syndrome. Identifying this feature is crucial for an accurate diagnosis. Treatment typically involves medications to manage heart function and blood pressure. These medications help stabilize the heart and prevent further complications, ensuring a smoother recovery process, along with lifestyle changes to reduce stress. Incorporating relaxation techniques such as meditation, yoga, and therapy can significantly aid in the recovery process. Managing stress is a key component in preventing recurrence. In most cases, the heart recovers fully within a few weeks with proper care. Patients often return to their normal activities feeling stronger and more resilient. The journey to recovery, though challenging, is achievable with the right support and treatment. Section 6. Real-life cases from collective grief to celebrity heartbreak. The impact of broken heart syndrome extends beyond individual cases. Sometimes entire communities experience it collectively. After natural disasters, terrorist attacks, or the sudden loss of beloved public figures, there's often a spike in broken heart syndrome cases. This phenomenon underscores the profound influence of shared grief and trauma on our physical health. Celebrities, often perceived as living charmed lives, are not immune to this condition. The sudden passing of actress Debbie Reynolds just a day after her daughter Carrie Fisher's death is a poignant example. While the official cause of death was listed as a stroke, many medical professionals believe broken heart syndrome played a significant role. Section 7. A rare but real threat, understanding the potential for fatality. While most individuals recover fully from broken heart syndrome, it's crucial to remember that it can be fatal in rare cases. The weakened heart, struggling to pump effectively, can lead to complications like heart failure, fluid buildup in the lungs, or life-threatening arrhythmias. The risk of fatality is higher in individuals with pre-existing heart conditions or those who experience severe initial symptoms. While this aspect of the condition is understandably concerning, it's essential to approach it with a balanced perspective. Understanding the potential risks underscores the importance of seeking prompt medical attention and following treatment plans diligently. Section 8. The resilience of the human spirit. Embracing the potential for healing. Despite the potential severity, it's important to emphasize that most people recover fully from broken heart syndrome. The heart, remarkably resilient, often returns to its normal size and function within a few weeks with proper medical care and stress management. This healing journey highlights the incredible capacity of the human body to recover, even from profound emotional and physical stress. Lifestyle modifications, including stress-reducing techniques like meditation, yoga, and deep breathing exercises, play a vital role in both recovery and prevention. cultivating emotional well-being through therapy, support groups, and nurturing healthy relationships is equally important. Section 9. A final word. The importance of emotional well-being. Broken heart syndrome serves as a powerful reminder of the intricate connection between our emotional and physical selves. It underscores the importance of prioritizing emotional well-being, not just for a healthy mind, but also for a healthy heart. Just as we prioritize physical health through exercise and a balanced diet, we must nurture our emotional well-being, recognizing and managing stress, seeking support when needed, and cultivating healthy coping mechanisms are crucial steps in safeguarding both our hearts and our overall health.